You're listening to Parents You've Got This, the expert guide to parenthood, the complete guide to fertility, pregnancy, birth, baby and parenthood. This podcast is proudly supported by Mistela, a natural origin skincare for babies and children, recommended by healthcare professionals. Mistela by Parents' Side since 1950.
You're listening to the Expert Guide to Parenthood podcast with your hosts, Christy and Freya. We're from Parents You've Got This, and we've created the most incredible podcast, the Expert Guide to Parenthood, where we talk about all things involved in parenting, pregnancy, fertility and birth. We love to talk about all the topics that nobody does, or the ones that are trending, and this one is trending. We're going to be talking about ADHD today.
We are joined by our paediatrician expert, Dr. Lexi Frydenberg. Dr. Lexi is an experienced general paediatrician working with children and families to the age of 18. She is a really important member of the Parents You've Got This expert team, and we are thrilled today to pick her brain on this important topic. Lexi, thank you so much for joining us today.
Thanks for having me.
Now, let's start off with the basics. What is ADHD?
So ADHD is a neurodevelopmental disorder. It stands for Attention Deficit Hyperactivity Disorder. So it's where there are difficulties paying attention and concentrating. Kids have excess activity levels, always on the go, and also have trouble with impulse control. So it's really how the brain is wired, and it's a really common condition that we see in children, and we're seeing more of it in adults now.
And so what are some of the signs and symptoms that parents can look out for if they think that they may have an ADHD child?
So I think it's really important for parents to remember that all children have trouble concentrating, sitting still and impulse control issues. And that's just normal part of developmental process. So in children before their school age, if you go into a kinder or childcare, all the kids will have a very short attention span. They'll be getting up off the mat, running around, putting their hand up, talking over each other, pulling toys, really struggling with activity levels and impulse control. But it's not an issue in that age group because it's a normal developmental process. But as children and their brains mature, many of these features calm down. And it's when a child has these ongoing persistent issues, particularly in a classroom setting where they're needing to pay attention, concentrate and sit still in order to learn, that ADHD might first become part of the conversation.
So how is ADHD diagnosed?
So there are a few different types of ADHD. So the most common type is what we call combined type ADHD, where children have all of the features, so the inattention, hyperactivity and impulsivity. But you can also have a predominantly inattentive type, and that's often picked up a bit later, often with girls who are quiet in the classroom, who might be, in inverted commas, daydreaming, but it may not be picked up because they're not hyperactive, but they have an inattentive type ADHD, and then there's a predominantly hyperactive type. So your child may have any of those types, and usually it's picked up by observation across two settings. So usually it's either in school that the teachers might, call you aside or tell you at your parent teacher, just keeping an eye on your child. They seem to be having trouble concentrating. Or parents might realise that, they're doing homework with their child, or particularly over COVID, a lot of parents realise that their children really struggle to pay attention and they've never noticed it before.
So you talked there a little bit about parents, caregivers and teachers and their role in the diagnosis of ADHD. How do they go about diagnosing it?
Yeah, so I think collecting those observations is really important across two settings, so home and school. So we'll often do questionnaires, which I'll talk about in a moment. But if you're worried that your child is struggling to pay attention or not learning well, you need to remember there are other things that cause children not to be able to pay attention. So we need to ask them, and a GP can start this process, about their sleep, because if a child's not sleeping, they're not going to be able to learn. About nutrition, about other things they may be experiencing at school, so anxiety or bullying or learning difficulties. So there are lots of other reasons why a child can't concentrate, and we often will make sure we're managing those first before going down a diagnosis of ADHD. If you've spoken to the GP and there are concerns about your child having ADHD and you want to go down that path, you'll be referred to a paediatrician, a general or developmental paediatrician. And what we do as a paediatrician is, once again, ask a really thorough history, examine the child, and then try and get some standardised questionnaires filled out. And they're usually done at home, ideally by both parents, as well as at school. And in the older kids, the teenagers, we get them to fill out a set of questionnaires as well. Because the diagnosis of ADHD is based on a set of criteria, what's called DSM-5 criteria, and you need to fulfil a certain number of criteria to make the diagnosis. Unfortunately, there's no blood test, no brain scan, no easy way to diagnose ADHD except gathering all this information over time across 2 different settings.
And then, Lexi, sometimes a diagnosis can be an uncomfortable or a controversial thing. What happens if 2 parents have a different feeling about the process of diagnosis and also then whatever the diagnosis might come back as?
Absolutely. I think that's a really common scenario. So if, as paediatricians, I would love to have both parents in the room to have a discussion about what they observe in their child and what the options are for treatment. That's not always possible, but it is, the ideal scenario. But often one parent will be, intent on getting a diagnosis so they can help their child and potentially get some treatment started. And the other parent may have a lot more questions or may have preconceived ideas what a diagnosis means. So I think it's really important to spend time. You don't have to rush to make this diagnosis, because once there is a label or a diagnosis, it is often there lifelong. So very few children we do take away the diagnosis, but that's uncommon. So you really want to take time, and as a paediatrician I want to give a lot of information, written information or resources for parents to read, and we can talk about that after. But I also want to give both parents the opportunity to ask questions, and there is no silly question because this is a really complicated, nuanced topic. As I said, it's not like iron deficiency. There's no blood test and there's not a clear path that everyone needs to go down in terms of treatment.
It's interesting what you say there in terms of, taking the time to get towards a diagnosis, but then also once you have a diagnosis that it's a long-term thing. What does that mean to have a diagnosis? Does it have any impact beyond a parent having some more information and being able to help their child? Is it a box that then you need to tick as you go along? Or how does it actually impact that child ongoing?
So I would say the reasons why parents come to me to make a diagnosis or to formalise a diagnosis if they have concerns are usually one of 3 things or all of them. If the child's having trouble at school, particularly with learning, so they're not reaching their learning potential, we talk about what we can do to help that child. If they're having trouble with friendships because of their impulsive behaviour, they're always in other children's space, they're not able to maintain those friendships. For that reason, they may come to us to talk about what can we do to help our child. And if your home life is chaotic, which many of ours is, and there's lots of reasons for that, but if you are really struggling in the mornings after school, on the weekends with your child because they're just like an Energizer bunny on the go, 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 and it's starting to impact on the family life, that's the 3rd reason. So people may have 1 or 2 or all 3 of these reasons. But the reason why many people do decide to go and have a diagnosis is a fewfold. 1, it helps parents understand their child, understand that their child's brain is wired differently, and often it gives more empathy and understanding if they're different than we are. 2, it depends on the age of the child, but it often helps the child understand themselves. So they're wondering, why am I the kid who always gets in trouble? I'm just being friendly. Why isn't anyone wanting to hang out with me? Why am I working so hard but I still can't remember and learn and follow instructions? So their self-esteem can really drop if they're really struggling at school and a path hasn't been gone down. So I think for the parent and the child it's helpful. But it also helps many teachers and those who provide care and teaching for our children to teach differently. So obviously in the ideal world, teachers would be able to teach to the individual child because every child will learn slightly differently. That's not the reality in our classrooms when there's 20, 25 children. But if a child does have an ADHD diagnosis, it might make teachers more aware of particular ways to teach that child slightly differently, classroom strategies they can help with, different homework modifications, and particularly in the later years, in the high school and VCE years, often children will get some extra time for their VCE exams or may have the opportunity to go and do exams in a quiet room. So not everyone needs to have a formal diagnosis, but there are reasons why people choose to.
Want some extra tips to help you navigate parenthood? Join a Parents You've Got This masterclass. Visit www.parentsyou'vegottthis.com.au and sign up for a masterclass today.
You mentioned early on about age, that children's behaviour is a certain way up until a certain age. Does that mean ADHD only can be diagnosed after a certain age?
So most of us don't tend to diagnose it in the preschool children. There is the rarer circumstances where we do, where it's very clear cut from a very early age and it's having a massive functional impact on the child and their family. But most of the time we wait till they're 5 or 6 to see them in that school structured setting. Because as you know, in a kindergarten setting, there's a lot more free play. You don't have to sit still. You don't have to focus for long periods. There's a lot more visual learning. So it's usually not till school age 5, 6 that issues might be brought to attention. And as I mentioned, particularly with the inattentive type ADHD, it's often in the higher primary school years. But we even have kids in year 10, 11 and 12 coming to us who haven't had a formal diagnosis. But looking back at their learning history and their story, it was probably there but not picked up.
What about treatment options, Lexi? What are some of the options that parents and children have?
So I think it's really important not to think diagnosis of ADHD, let's get them on medication, because there's a lot in between that. So really starting with what are some other contributing factors to my child's behaviour or poor attention. As I mentioned, sleep is vital, nutrition, particularly iron, is a really important mineral for concentration. Fish oils have been shown to be helpful as well for attention and concentration, and managing what we call comorbidities, so the sort of things that come along with ADHD in a lot of 50 to 70% of cases. So if your child is anxious or has a learning difficulty, then we want to also manage that. But when we're talking about ADHD in itself, really the strategies are behaviour strategies for the child, so helping them learn how to regulate their behaviour and emotional regulation. Classroom strategies are important, so making sure that that the child is near the front of the class or in a position that they can focus their best. Some children need to get up and down and move, so they often get tasked as being the role monitor and having a break in the middle of the class. They might have standing desks available at the back if they need a break just to move. Some children have fidget toys and other things that our OTs can help them with. So really there's the behaviour strategies, the classroom strategies. Parent education is essential because I think we can't leave it all to our school teachers. This is something that's pervasive across home and school. But then there's also the role of medication, and of all the things that have been shown to be the most helpful, it's a combination of medication, behaviour and classroom strategies.
So how does medication work? How does it help the child?
Yeah, so the medications you will likely hear about for ADHD are a class of medications called stimulant medications. So people think, gosh, you're giving my child stimulant. They're already, stimulated. But it actually has been found to have the reverse effect. So it can calm children down. It can help slow the mind to the point where they can focus and attend and learn to the best of their capabilities. But the challenge is having those positive benefits and minimising the side effects. So the stimulant medications that you'll hear about, the Ritalin type medications, methylphenidate, so there's Ritalin, Concerta, and then there's the dexamphetamine group of medications, so dexamphetamine and Vyvanse are the common ones in Australia. So we have stimulants, and that's the first line medication treatment for ADHD according to all our guidelines. If a child can't tolerate those or they have significant side effects to those, there are other classes of medications you might hear about. There's something called guanfacine, Inciniv, which is becoming more popular, and it can be used as an add-on or it can be used alone, and another medication called clonidine. So there are different groups of medication that we might trial, and it is trial and error. Unfortunately, we can't do any blood test once again to go, this medication is the right one for your child and it's going to work. It's trial and error. We start low, we go slow, we monitor very closely for side effects, and we watch for progress and improvement in the core areas we're trying to make a difference. So that's attention, concentration, some kids hyperactivity, some kids impulsivity.
So Lexi, how do you suggest and when do you suggest that you talk to your child about a potential diagnosis?
So I suppose it depends where you are at in your journey. So if a teacher's come to you and had a conversation, then I would just have a conversation with your child. Oh, your teacher said that you're really struggling to sit still. What's going on? And do you find it hard? What's happening in your brain? And really just trying to find out if they're old enough to be able to express themselves, what is going on for them. And really take them along the journey with you. So, when you see a paediatrician, we always need to see that child. We can't make a diagnosis without seeing the child. So it's not just, a tick box, here you go, here's your medication. We try and get the child involved if they're able to tell us some information, but they're going to be the one who needs, if they get prescribed medication, they're going to need to take that medication. So they need to understand why and be able to tell us what their experience of that medication is, good and bad. So I don't think you should shy away from having a conversation. You just need to use the words and terms that are appropriate for your child and their age. You need to stay positive and just say, we're here to support you. Your brain's just wired a bit differently. Some children have asthma and their lungs are a bit different. Other children have ADHD. How can we work with your teacher and you and your friends, if you want to talk to your friends about it, to make this an easier path for you and your child?
Yeah, that's such good advice, because I think it must, to feel as a parent that you're giving your child like a label or medication, that could be really daunting. But, if it's going to help them and know that it's part of a journey for them, I think that's really good advice.
Yeah, and I think, look, if your child has epilepsy, if they have seizures, yes, most parents don't steer away from telling them, you have epilepsy, yes, you have seizures, you need a medication. So, I don't know, there is a stigma around ADHD and some of the other neurodevelopmental conditions, learning difficulties, dyslexia, etc. But, my approach is trying to be open and not show your own fears and concerns in front of your child. You can have those conversations with your doctor or with your friends or with support groups, but try and be a united front with both parents in front of your child and go along with the plan.
Yeah. Well, Lexi, why is it that everyone suddenly has ADHD? I feel like it's very trendy, or, some of the older generations are saying, is it because we're not, providing enough structure or discipline in children? Why is suddenly this whole lot of ADHD, or is it just that we have more knowledge now?
Yeah, look, it's a really complicated question. There's no simple answer. Yes, we are hearing more about it on the news, on the radio, there's more media, which is a good thing. It just means people are talking more openly about it. We are seeing many more adults being diagnosed, and often we would make a diagnosis in a child and the parent would go, oh, that was me. That's yes, what happened to me at school. I'm going to go down and get diagnosed as an adult. So there is definitely an openness about it, and it's being more talked about, and there's less stigma about having a label. So I think that's one reason. But I think we can't ignore what's happening in the world and the environment around us. And I don't know if you've read Johann Hari's book, Stolen Focus, but it is about how big tech has taken away our ability to focus. So there are so many other reasons that contribute to why we can't focus, pay attention and sit still. Most of us are sleep deprived. Most of us are on our phones, a lot, and that is just taking our attention away. So when you're thinking about strategies to help, yes, it is a neurodevelopmental condition, but you can't ignore all the other contributing factors to our attention and concentration. So multi-million-dollar question. We are hearing about it more, but I don't think that's necessarily a bad thing. Just to think about why is important and to think about the nuance in your child or your case.
You mentioned there about parents, often going then getting their own diagnosis. Is it hereditary? Like, is it something
Yeah, so there is a genetic component, but it's not, we don't have the exact gene to say, look, if, Christy, you have ADHD, 3 of your children are going to have ADHD. So it does tend to run in families, like many of these neurodevelopmental conditions. But often, because it wasn't diagnosed very often when I was young, many of my friends and colleagues sort of just might have struggled through school or, had trouble with friendships or, never met their potential. And now they're going, oh, that's why it was so hard for me. I really wish I knew more about this. So, yeah, look, I think it's really important for parents and adults to read about it, but not just jump to a diagnosis and one treatment.
Yeah, and I think ADHD can be a superpower. I don't know about you, but some of the most brilliant minds I've ever seen, they have ADHD. It's because their brains think a little bit different, a bit outside the box, and they end up being the most incredible people. So it can be their superpower.
Absolutely, and it's a spectrum. So, not all people with ADHD are the same, not all people without ADHD are the same, and I think we've just got to remember that and think about the individual child or the individual adult when we're managing ADHD.
So, Lexi, what are some of the other treatment options other than medication?
So there are many strategies that we can put into place to help our children and not just use medication alone. So those involve behavioural strategies, so helping the child learn how to regulate their emotions, and that's often done with the help of an allied health professional, so potentially a psychologist or an occupational therapist can be involved. There are school and classroom strategies, so letting the child sit near the front of the class. They may need headphones if it's a bit overwhelming for them and they need to really be able to focus and concentrate. They might have some standing desks available at the back of the class, or they might be given a job to be the role monitor so they can get up and leave because they need to sort of wiggle and jiggle and move a bit. So both behavioural and classroom strategy is important, but I think parent education and support is essential as well. So parent coaching can be really helpful because we can't leave it to the teachers alone to help manage our children with ADHD. Parents need to be on board and they need to really get to know their child and what works. And as we mentioned, obviously there's medication, and it's usually a combination of these treatments that works the best.
Lexi, thank you so much for coming on the Expert Guide to Parenthood podcast. We love having your episodes on. If you want to hear more of Lexi, make sure you have a look through our catalogue. We have got a whole host of different episodes on the Expert Guide to Parenthood covering all the topics that you need to know to help you and your child on their parenting journey.
A huge thanks to Mistela for sponsoring this episode. Mistela empowers parents throughout their parenting journey with education and honest conversations from pregnancy and beyond. Mistela has plenty of parenting articles and resources on their website. Visit mistela.com.au.
You've been listening to the Expert Guide to Parenthood podcast. Never forget, parents, you've got this.
Join a Parents You've Got This masterclass today to be prepared, excited and educated for pregnancy, birth, baby and parenthood. Visit www.parentsyou'vegotthis.com.au and sign up for a masterclass today.
The information provided in this podcast is general in nature and is intended to support, not replace, a discussion with your doctor or healthcare professional. Parents You've Got This take no responsibility for any medical decisions made by individuals based on the information provided in this podcast.